Today I have Jamie Carter with me. I'm very excited to interview her because she is a hygienist. She's one of our members at NNHH, and she's also the Director of Oral Health at Health Partners of Western Ohio. So thanks for being willing to chat with me today, Jamie. I just wanted to share this with our members and students because I think your role is really inspiring and that a lot of them would love to have a role like yours. So why don't you tell me about your current role first, and then we'll go into how you got it, which is what they're all going to be wondering.
Sure. So I am Director of Oral Health Integration. And so we added that integration part in. I'll tell you as I'm going through my career advancements. But what I do now is we have 7 dental offices that I help manage, as well as 11 dental outreach teams. So our outreach teams, we go out to the schools during the school year, and we do cleanings, fluoride, silver diamine fluoride. We get exams by our dentists, all that kind of stuff. So I help manage basically all of them. And then also one of my main roles is to integrate oral health into our medical teams. So I work for a federally qualified health center. So our 7 sites that we have, our 7 brick and mortar sites, are a large health center. It has medical, dental, behavioral health, a pharmacy, pediatrics, as well as adult providers. So we try to be a one-stop shop. We're a patient-centered medical home. So we try to integrate all specialties when a patient comes into our office. And so one of my roles is to try to help make sure that patients get every advantage that they can when they come to see us. And so one of our bigger projects for this year is having our medical teams applying silver diamine fluoride to teeth while the patients are seeing a medical visit. And that came from the new medical code that just came out. So there's always...
How's reimbursement right now? I know
0.
It's early, but
you don't get reimbursed for it yet.
Okay.
It's a tracking code, so we're just eating the cost because it's the right thing to do, and we know that it's really helpful for patients. So a lot of that was is training our medical teams, training all of our medical providers and our support staff, training our receptionists on why we're making some switches and changes to schedules and things like that. So it's been a big push for us because we know that we touch enough patients in Ohio that we can make a big difference. So
wow, I mean, so how big is your team then? Your dental team at the FQHC must be 20, 25 people or more?
So we have 7 different sites. So most of our sites are about 6 operatories. So we have 1 dentist, 1 hygienist, and then a handful of dental assistants. So that's a team at a site. And then our dental outreach team consists of a hygienist and an assistant. We also use a dentist to do the exams first, and then we go back as the team to do the treatment. So our teams are fairly small. I mean, the health center ones are normal size dental office, but our outreach teams are fairly small, just a lot of them.
Wow. So did you start as a clinical hygienist in the system and move your way up, or did you find this role because you were into management already and we're looking for something like that?
So no, I graduated from hygiene school and started part-time at our health center, and then moved to full-time. And then I worked in our dental office doing clinical work, just like every other hygienist in the world. For about 10, 12 years, I worked in the dental office. And really how my role kind of evolved was our director of pediatrics. She kept seeing kids that came in to see the pediatric medical office with all these baby bottle tooth decay and all kinds of problems and abscess tooth and pain and all this. So what she did was she just would walk over to dental because we're under the same roof. And she said, hey, will somebody come look at this patient and help me figure out what to do? And so that conversation and those talks that her and I had together became, well, could we embed myself into the medical department? and just work in medical. And so we did that. I did that for a few years. And that's something that's starting to become more common in health centers throughout the United States, is an embedded hygienist in the medical team. And of course, you got to watch your state laws and make sure that, because you have your dental license, so you have to follow the dental board rules. So you have to be careful on that and make sure that you're following, the rules for your state. But in Ohio, we could provide oral health education, do fluoride applications, and then refer to our dental office for comprehensive care. And so that's really what it was, a lot of just education for patients and parents and caregivers. And so I did that for a few years. And we saw some really great results with that. It was just a very good collaborative effort. So we spread that as much as we could. Of course, then, COVID happened. And so we couldn't find a hygienist to save our life for a while. And still struggle with that in public health. I think, that's nationwide no matter what, but public health especially. But so we still do have one embedded hygienist at our biggest site with about 8 primary care providers. And that's that's adult medical and pediatrics. And then on the medical side of things too, what we did was we would target diabetic patients. And so we would walk that patient over to our dental office, take a panoramic x-ray, have our dentist do a quick, diagnosis off of that. And then we'd schedule accordingly. We'd go over a lot of education and, things like that. So that was another thing that we did as an embedded hygienist. And then, like I said, COVID happened. And so we struggled with providers, we struggled with dentists and hygienists. And so we hadn't had a dental director for a bit. And when we were ramping back up, once COVID was over and we were allowed to kind of open back up and get back together, I just kind of took on the role of, okay, well, we need to change this policy and we need to add this kind of PPE and these kind of trainings, and, all those things just needed to be put in place that I just stepped into because I'd been at our health center for 12, 15 years. And so I just had that knowledge base that unfortunately we didn't have anywhere else. And so I just kind of took that over. And once we did get ramped back up, and so things started settling down, what our health center did was we created an integration team because we had gone a long time doing silo care of, medical did their thing, our behavioral health providers did their thing, dental was way over here doing whatever we needed to. So we're really fully integrated with our behavioral health and medical providers. They go into the room together. They, they talk to patients together always. And so it's really that oral health piece was missing. And so we created an integration team where we would go, our team would go around to all the different sites to go over patients' quality measures, things like our diabetic patients lowering their A1C after we've had some behavioral health intervention, some oral health intervention, things like that. So that team had kind of even evolved more into being directors of whatever our specialty is. And so that's how, my role actually stemmed. And then, so we try to utilize the best people in the right spot. And that's kind of just where we went with who we are and how we operate. So it's just become a different way of looking at things that we know. I know oral health like the back of my hand, and our behavioral health director of behavioral health knows, substance abuse and behavioral health issues. And so we all have offices down the hall from each other, so we can always collaborate. We're always in our operations meetings together, so that way we know what everybody's doing, so that we can make some tweaks and changes with how our providers are seeing our patients.
Wonderful. There's so much good in there. There are 2 points that I want to bring back around are, number one, that you're just a natural leader. And I think that it's so important for us to highlight here that hygienists are natural leaders. And so you were in that unique situation where you had an opportunity presented to you and you could have shrunk back and said, I'm not ready. I don't know enough. But you jumped in and said, yes, I will take this on. And as a result of that, your leadership abilities just kept continuing to expand because you didn't have a choice.
Right.
So I think that for so many hygienists, they wait thinking that they need a certain degree or training or, something. But if you just jump in and you're willing, the leadership abilities you have naturally inside of you just show up, right? Is
Absolutely.
that what you found?
Yeah, yeah, absolutely. And I obviously was very blessed that this just all kind of fell into my hands. But there's no reason that you can't go out and just say, I see the need, I know what the need is, and I know how to help.
Yeah,
And that doesn't necessarily, I mean, a health center is a different scope. It's just a different population. It's a different, beast altogether than like a private medical office or a
correct. It's
nursing
more
home.
challenging and often more rewarding, really.
Absolutely. Yeah.
Yeah,
So, but a health center doesn't have to be where this ends. It could be a hygienist going into a nursing home, going into a private practice, medical office, hospital setting, all kinds of different things that your skills, what patients need and what could be helpful, and just how do you manage it and utilize it and prove your worth.
yeah. But health centers really are the model that,
Mhm.
hospitals and healthcare systems and even private practice dentistry, if we take a look at what you guys have done and what's working well, what would you say to a health center that maybe wants to integrate oral health, and for whatever reason they haven't been able to so far? What would be that first step?
So the big thing is our health center is not our health center is very willing to change, to try something and pivot a different way because it didn't work the first time. We have created a culture of being okay with change, being willing to try something, and if it doesn't work, change it up again, and be willing to fail. So I think that's just our culture. I think that that's a hard thing to teach and to move into, but it's very rewarding because if you're willing to be the first, if you're willing to make that change, you can have some great results. I mean, so just with our SDF, for example, we were very nervous about implementing SDF in our school-based health center or in our school outreach teams. And that's because we don't have parents right there to show them the color change and on teeth and things like that. So we added it to our consent form. We make phone calls to parents, and we blast it on our social media pages and things like that, so everybody is very aware. But we've put just the school year SDF on I think 23,000 teeth so far. So
Wow.
it's a huge impact that's going to make a
Oh my
huge change.
goodness. That
Yeah,
is enormous.
exactly.
Wow.
And it's, I mean, we're having a dentist diagnose it. We're following all the rules, but we're doing something that other people are scared to do, just even in the office with the person, with the patient that's an adult to sign a consent form. People are scared to use it, I think, at this point, and they don't need to be. So it's
Yeah.
it's our culture to be okay with trying something, and you may fail, we started SDF before the dental board kind of slapped us down a little bit on hygienists doing it. So then we had to take the class, and then we have to get it diagnosed, and so we have to follow the rules because that's how the rules changed. But we weren't willing to, or we were willing to try it before we had the rules and implement, all the things out there. So I think that's a big takeaway for us is you just have to be willing to try it and see if it works. And if it doesn't, what could we do differently to make it make sense? And really make sure that the patient is the biggest focus and make sure the population health is a bigger focus there to see, what changes could we make that may impact a whole entire population of patients.
Right. And that is definitely a mindset shift if someone's coming from private practice dentistry over to public health. I love that I think exactly what you said was that innovation requires us to not be afraid to make mistakes. You're going to make mistakes. That's how we learn. That's how we innovate. That's how we actually improve population health, is by trying things to see what works. So I love that you said that, because I think that that's a really important point for someone who maybe is interested in public health, but hasn't found a position yet. And I also love that you said this fell in my lap, because my public health jobs all fell in my lap. If you open your heart to the fact that you're willing, it will fall in your lap. I mean, I can probably list 20, 25 hygienists right off the top of my head who I have told me the exact same thing. I didn't find this on Indeed, right?
Yeah.
Uh, I worked my way through trial and error, through being willing. And I just absolutely love where you're headed. And you're a student right now in our Oral Systemic Educator Certificate Program. Thank you to Delta Dental Foundation and the NNHH Board of Directors. So it was a partnership, a collaboration funded by both. Tell me what you're thinking about doing with it. Are you planning to bring that knowledge down to your whole healthcare system?
Absolutely. So, I mean, what I'm learning right now in that program is maybe some softer skills that I didn't have, because I'm just kind of going with, what's working for us so far. But I certainly don't feel like I know it all, and I have all all the things ready just in my back pocket. So I'm learning some things about, right now I'm in the leadership class, which I like you said, I think I am a natural born leader, and I am good at, and just trying it and going for it. But there's definitely things to learn, things that I just don't know naturally. But yeah, so, and the hardest thing for us right now is teaching and training and pushing our medical teams. And so this program that I'm in right now is really helping me to kind of hone in on certain things that I need to focus on, because normally when I'm talking to our staff, it's the dental staff that I'm talking to. So when I have to shift my whole focus when it's medical teams, because they're scared of teeth, they're scared of oral health, they didn't learn
Yes.
any of it in school, and so they just have
Brilliant.
no base.
Yeah, you're so 100% right. And I love that you're saying even with your position, right, director of oral health, you're still a little bit intimidated. Intimidated maybe isn't the right word, but you're still looking for increased confidence when it
Yeah.
comes to how to approach them with this. And I think that our instructors did a great job of giving um, so many opportunities and so many ideas and talking points that you can really make it your own when it comes to how you're going to share this with them. And then from a management perspective, start to integrate some changes within the healthcare system itself. So how exciting. I can't wait to read about your capstone project. Do you know what you're going to do yet?
Oh, so SDF is my whole life right now. Most of it. So it's probably going to be about SDF and,
I love
how
that.
we're moving that project forward. So, there's struggles and there's some wins in there too. So
Yeah.
you're always going to have a little bit of it. But yeah, like you said, public health is very rewarding. I think that people don't know what they don't know. And I think public health is one of those that we kind of touched base on it in school, but it's not like given to you as this is a really good opportunity that
Yeah.
people just don't know about. And it's very, very rewarding, from when I'm in there seeing one patient and I can make a change in that patient's life, up into now where I'm touching, my whole team that are
Yeah.
seeing hundreds and hundreds of patients every day. So yeah, public health is one of those that I don't think people realize is as special as it is. And
I
one
think
one
that's
quote
why.
that someone
Go ahead.
has said before is, when you've seen one health center, you've seen one health center. I think that's true in private practice too.
Yeah.
But if you do hear stereotypes and some negative connotations when it comes to public health sometimes, but don't let that scare you when you hear something like that, because it down the road may be completely different, and you may have really good leadership. I have really good leadership with my health center that I can bring anything to our CEO and she'll consider it. It might be the most off the wall thing, but nothing's off the table for us, because if it helps our patients, then it helps.
Right. And I have found in public health that the patients are so grateful.
Absolutely.
It's just compounded by 10 compared to private practice dentistry, where they expect you to take good care of them. In public health, they are just so immensely grateful. I mean, the tears of joy and gratitude are often just, they're there every day. And even
Mhm.
when I was doing school-based sealants with dental hygiene students, we were into 12 low-income schools. The kids were grateful. The school staff was grateful for the education we were providing. So everyone is very glad to see you versus the other way, right?
Yeah, yeah.
Sometimes in private practice. So yeah. Well, I know that you're busy, so thank you so very much for chatting with me today. One last as you go kind of talking point, what do you think what do you think would be a really great way for a hygienist that would love to get into public health? How would you recommend that they start?
So HRSA.gov is who kind of oversees all health centers, and then you can go by your state and then go see what your state health center kind of organization is. So for Ohio, it's Ohio Association of Community Health Centers. And so that website will tell you all the health centers that are in your state. And then everybody's looking for providers. So dentists and hygienists are hot topics for us. We always need providers to come work for us. And that's one thing that you might notice, that I'm saying a provider and not just a dental hygienist. So dental hygienists are providers just like any other medical dental provider that we have in health centers. And so you get that little bit more respect as a hygienist in a health center than because the dentist is very rarely the boss. So it's
That
a
is
different
true.
dynamic.
Structure, yeah, definitely a different structure. And I also forgot to ask you about your education. So did you go back to school for leadership or management, or do you just have your RDH?
I just have my RDH. I mean, we do a lot of like internal trainings and leadership
Right.
programs and
That's
things,
what I
but
say to
yeah,
hygienists all the time. You do not need to go back to school to have a role like yours. You will
yeah,
learn on the job. You will just continue to grow as you go. So I love that you've just been
yeah,
able to really own this and look what you've done with it. I can't wait to see what you do in the next couple of years.
yeah. Thank you. I appreciate it.
Wonderful.